Women in Mashawa are building and funding a shelter for expectant mothers who live far from the nearest clinic. The mothers will be able to stay here while they are waiting to deliver their babies at the Zamahande clinic, about 4-hour drive south of Harare. Joyce Mapako, who is leading the campaign, says the idea came after many mothers failed to reach the clinic before giving birth.
Because of the distance to the clinic, most women are giving birth on the way there, or some at home. In some cases, some are lucky to get a car, but it comes speeding, causing accidents. So we resolved that to end that, we need to build the shelter. It helps even after giving birth for a mother to have 2-3 days at the clinic while being assessed by health officials.
Zimbabwe's Ministry of Health and Child Care welcomes the development. Nyatwa David is the sister in charge at the Zamahande clinic.
A mother's shelter is important in the sense that it reduces the number of deaths of children being born at home, being born during the way, on the way to the hospital, and it reduces the transmission of diseases like tetanus, because if it's conducted on the way, there will be no one who is able to provide safe delivery services.
A charity group, Voluntary Service Overseas, is training the smallholder farmers to push for access and quality health services in their community. The women are contributing $1 and 20 bricks per household. Tekla Ponde heads Voluntary Service Overseas in Eswatini, Zambia and Zimbabwe. Ponde says her organization wants to ensure that women's sexual and reproductive health rights, or SRHR, are upheld in Zimbabwe.
So this shelter was key in that it would facilitate access to SRHR, enable women to access shelter and waiting areas whilst they are on prenatal, or even at least when their time is due. So it's very key for us to also look at women's needs and how we support women.
Maternal mortality in Zimbabwe is 663 per 100,000 live births, according to results of the 2022 census, slightly higher than the 357 deaths per 100,000 recorded in 2020. The women of Mashawa are hoping their efforts will save lives and lower the number of maternal deaths. Mavhunga, VOA News, Mashawa, Zimbabwe.